parents, especially moms, they're left with guilt, fear, confusion, self-blame, and they don't know who to trust. This is just further confounding their trust in themselves and getting them to know that they're the best parent for their child.
And you said you are a founder of a learning a school?
Yes.
Or?
It's a tutor match platform for neurodivergent kids, and we work with families. I have my own neurodivergent kids, and we know that if we work with their strengths, that we can be neuroaffirmative. And this is not a death sentence. I don't understand why a professional, like a federal body, is stating this claim, and it's already so difficult for moms. Science is slower and fear is fast.
Science is slower and fear is fast. Can you elaborate on that a little bit?
So as Deepa and Tracy were talking about studies and the information that's come about globally, there's a lot of studies that are talking about observation, but science is still figuring out a lot of different aspects of autism. Correlation is not causation. And as a parent, when you're extremely afraid about what your child's future is going to look like, you might just grasp for whatever is in front of you.
There is absolutely no scientific research that supports these claims. There is absolutely nothing that gives this argument basis in real science. So what I don't understand, I understand we have to address the misinformation, but I think a large part of the problem we have is the way that the media covers these things and the way that we talk about them. This shouldn't be a debate. We shouldn't have to be debating this. It's not debatable. It's not true. It's frankly, flatly not true. And as a researcher and someone who works in research myself, there is absolutely nothing substantive to this. So why are we bothering to entertain it as a valid premise?
Okay. And to be clear, we're not debating that claim itself. We're talking about what is the impact of it, because we have had reaction from medical officials and from the community. Really interesting point. And Lynn, you're a researcher yourself. I mean, how are you feeling?
Yeah. Frustrated. It's extremely frustrating to see, the president of the United States to go on TV and spout something that is absolute pure nonsense. Science matters. It's, we've learned these things over hundreds of years, and we've built up a body of knowledge. And I think that, the impact it has on women, shaming women, thinking that, the reason someone's autistic is because of them, not that there's anything wrong with autism, denying women pain control when they may need it during pregnancy, or, it's just, it plays into so many different vulnerabilities.
Let me go back to Deepa Singal. As a scientific researcher, I guess I'll get you to comment on what Lynn said, but also, yes, this comes from the Trump administration, but there is a whole movement, as someone emailed us saying there's the MAHA movement is a large one. So what is happening there?
A massive spreading of misinformation. We can sit here all day long and speculate why this is happening and generate, many of our theories, conspiracy theories. But, I think rather than debating inconclusive claims, because I fully agree with our callers, the scientific community has come out aligned with this statement that Tylenol does not cause autism. And rather than continuing to debate the inclusive claims and giving so much fuel to this noise, we need to bring it back to what matters most to autistic Canadians and their families. There are many issues, many system issues, inequities in care across this country, inequities in accessing services and supports, children who are not adequately supported to have their educational rights met by our public school system. There is so much work to be done here at home to support autistic Canadians, neurodivergent Canadians, disabled Canadians, all Canadians. So, I would love for us to have to stop talking about all of these inconclusive claims. The scientific community has a responsibility to respond. They have responded, and we need to move on to building a better Canada for everybody.
And on that note, I think that's a useful note to end on when it comes to Tracy. What impact or how does this impact the conversation around supports, the supports that you work for?
Yeah, when public pressure, misinformation drives the story, defines the story, it drives policy, public policy, which focuses more on finding cures and less on the day-to-day supports that autistic people like me and my kids and lots of other people need. And it focuses on prevention or fixing instead of on, housing needs, mental health supports. It impacts the mental health of autistic people and of parents. I heard from a parent last night who was really in tears and feeling like, if they had heard this a few years ago, it would have, sent them, what did they say, off the rails, into a spiral, because
What's
they
your
would have felt
message
so
then?
much guilt.
What's your message then to your members?
I think that, reach out to each other for support, follow and listen to autistic people online. There's lots of us out there talking, and we can speak directly to the experience of being autistic, and stop focusing on it being a broken thing that needs to be eradicated. That's just eugenics. We need to focus on everybody belonging together in community.